Not sure what you should be avoiding in between your first and second dose of the COVID-19 vaccine? We've got you covered. Consider the following guidelines from the experts while you await your final jab. According to the Journal of the American Medical Association, 2 doses are necessary for the Pfizer and Moderna vaccines. Dr. Brian Castrucci, president of the de Beaumont Foundation, a public health nonprofit, told Health Digest, "Taking the first shot is like getting to the halftime of a football game. There's definitely progress and you may be ahead, but there is a whole other half to play. The goal of a vaccine is to stimulate the body's natural immune response, a mimicry that, metaphorically, trains your body so it knows what to do in the event of an actual infection. For that to occur, 2 doses of the 2-part COVID-19 vaccine are needed. As Dr. Carlos Malvasudo of the Ohio State University Wexner Medical Center explained, the first dose primes the immune system, while the second dose induces a vigorous immune response and production of antibodies. Your body will have a weak immune response to just 1 dose, but a robust response with receipt of the second in the series. And according to the CDC, you are not considered fully vaccinated until a full 2 weeks after your second dose of the Moderna or Pfizer vaccine, or 2 weeks after the one and only dose of the Johnson & Johnson vaccine. As of mid-March 2021, more than 113 million COVID-19 vaccine doses have been administered in the United States. Each day, approximately 2.4 million doses are given, and 22.2% of the population has received at least 1 dose. With each shot given, we see a brightening light at the end of what has been a long and dark tunnel. With so many shots going into arms, we've also learned a lot about what to expect, which includes some soreness or redness at or around the injection site. Dr. Thomas Duzinski, Director of Epidemiology Education at Indiana University, told CNET, "With any vaccination, you can expect a bit of pain during and after the injection. If you experience this type of discomfort, take a pain reliever, use an ice pack, soak in an Epsom salt bath, or exercise your arm a bit." Some people reported a delayed local reaction, known as COVID arm, but you do not need to be concerned. Dr. Kimberly Blumenthal, an allergist at Massachusetts General Hospital, told the Today Show, "One of the biggest messages that we wanted to relay was that this isn't worrisome. It'll go away on its own." And Dr. James McDonald of the Rhode Island Department of Health told WPRI that COVID arm is not a cause for concern.
If it itches, people take an antihistamine like Claritin, or, and if it hurts, you take some Tylenol. It really is nothing to be worried about.
According to U.S. News and World Report, fewer than 1% of those who received the Moderna vaccine had adverse side effects. An even smaller amount of people had an adverse reaction to the Pfizer vaccine. Of course, that doesn't mean mild side effects aren't possible. Dr. Joel Kmeyer, infectious disease specialist at the University of Toledo College of Medicine and Life Sciences, told Health Digest, "Many people do report side effects with the COVID-19 vaccine. These are generally mild, but more than 80% of vaccine recipients reported side effects during the clinical trials. People have reported head or muscle aches, fatigue, fevers, and chills, but there's a good reason for this. Dr. Richard Watkins, professor of internal medicine at the Northeast Ohio Medical University, told Prevention, "Vaccine side effects basically show that the immune system is being primed. If you have side effects that linger, however, you should call your doctor. Nevertheless, you shouldn't skip your second dose unless advised by your physician," according to the CDC. As Dr. Kmeyer notes, both the Pfizer and Moderna vaccines were studied in the clinical trials as a 2-dose administration, and these vaccines are 94 to 95% effective in preventing COVID-19 after the second dose. Considering the fast-tracked creation of the COVID-19 vaccines, paired with the reality that some people don't experience any side effects, it's easy to slip into cynicism about the vaccine's efficacy. But everyone should trust that they are working as designed. Dr. Sachin Gupta, an attending physician with Alameda Health System, told Health Digest, "Like with other vaccines, the development of antibodies is not something felt tangibly. It is happening on the inside, with cells doing the job of converting amino acids into antibodies. The data helps us trust that these vaccines are working." As Time magazine summarized it, even a single dose of either vaccine was 85% to 94% effective in reducing COVID-19 hospitalization within a little more than a month after the first shot. Plus, the mRNA COVID-19 vaccines are up to 95% effective against symptomatic illness after both shots are administered, according to Yale Medicine. As Dr. Gupta notes, the science supports that the body is producing antibodies. Research shows that antibodies become quite measurable after receiving the second dose. If you are in between COVID-19 vaccination doses, you should continue to wear a mask outside your home. Dr. Francis Collins, the director of the National Institute of Health, put it quite simply on his site: masks save lives. And Dr. Sachin Gupta told Health Digest, people between COVID vaccine doses need to remain as vigilant about catching the virus as they are before they get the vaccine. If receiving the two-part vaccine, even a week after the first dose should be handled with care, as the antibody response will not have been fully mounted. Plus, you might inadvertently infect someone else. Dr. Brian Castrucci told Health Digest, "We are still learning if those who have been vaccinated may still pose a risk for transmission. So if you are around folks who are older or chronically ill who have not been vaccinated, please wear a mask and stay at least 6 feet apart." The rollout of vaccines is an exciting development and a beacon of hope for many. Nevertheless, following social distancing guidelines will continue to be very important, even if you've had your first dose. Dr. Neil Brown, a board-certified emergency medicine physician, told Health Digest, "Because we don't have clear answers about how the vaccines will affect the asymptomatic transmission versus simply protecting the person who received it, it's important to continue to be careful even if you've had your first dose." Social distancing, as we've all learned in the past year, is the practice of maintaining a safe distance between yourself and others, at least 6 feet or 2 arms length apart. And Dr. Brown says we'll need to keep it up, advising, "We are still in a learning phase with this vaccine, so people should still continue to observe social distancing guidelines following first and second doses of the vaccine to protect themselves and others." Although capacity restrictions are loosening up in many states, that doesn't mean you should suddenly throw caution to the wind and return completely to pre-pandemic life simply because you've received your first dose of vaccine.
I feel like the pandemic is over.
Really?
Yeah.
It does.
Experts are still advising Americans to avoid highly congregated areas as much as possible. Even after you've received both doses of the two-part vaccine and are considered fully vaccinated, the CDC advises avoiding crowds and poorly ventilated spaces until we know more. Dr. Neil Brown told Health Digest, "Right now, we're still learning a lot about the vaccines, but social distancing is a proven method to lower the rate of transmission. So I'd encourage people to continue mask wearing and staying socially distant as much as possible. If you are equipped with the right tech, take advantage of remote solutions for important things like doctor's appointments and faith services. If you have the financial ability, continue to use remote grocery delivery options. And if you must head into a crowded environment, wear your mask and socially distance yourself from others." Hand washing and the use of hand sanitizer when soap and water is not an option is the first line of defense in stopping the spread of infection, according to an editorial published in the Journal of Clinical Nursing in 2020. Focusing on proper hygiene to fight contagion is not a new concept. For years, campaigns have been effectively teaching students to cover their coughs. There's evidence of the effectiveness of these measures in the data surrounding influenza activity in 2020 and 2021. No doubt, heightened sanitation vigilance contributed to the historically low rates of influenza during the pandemic. So while you're in between vaccine doses, continue to wash your hands for at least 20 seconds. Or when water is unavailable, use a hand sanitizer that contains at least 60% alcohol. If you aren't already getting a minimum of 8 hours of sleep per night, consider right now a great time to start. A good night's sleep supports your immune system. And according to the National Sleep Foundation, getting enough sleep can improve your body's antibody response to vaccinations.
One of the earliest identified benefits of sleep, or negatives if you don't get enough sleep, is a change in your immune system.
In between vaccine doses, work on optimizing your sleep health by getting to bed early enough to allow for 7 to 9 hours of sleep a night. While scientists are still studying circadian rhythms and the way sleep quality may impact vaccination efficacy, no harm will come to you by optimizing your sleep quality in between doses. To start, avoid caffeine, alcohol, nicotine, and other sleep-inhibiting chemicals, according to the Division of Sleep Medicine at Harvard Medical School. Also, consider creating an environment in your bedroom that is conducive to sleep, and establish a stress-relieving bedtime routine. When it comes to quarantine guidelines, it's important to remember the point: to keep people who might have been exposed to the coronavirus from others. It's not the same thing as isolation, which keeps someone who has tested positive for COVID-19 from others who are not infected, even within their own home. If you are in between vaccine doses and have been exposed to the virus, you will still have to quarantine. That means staying home and monitoring your health for 10 days without testing, or 7 days after receiving a negative test result for a test taken on day 5 or later. There are a couple exceptions to this guideline: those who tested positive for COVID-19 within the previous 3 months and recovered, and those who are fully vaccinated. If you are in between COVID-19 vaccine doses and someone you live with develops symptoms, encourage them to get tested. That's the only way to find out if you are at risk of contracting the virus yourself. Concurrently, you should avoid coming into close contact with them as a precautionary measure. That means keeping a safe distance of at least 6 feet, wearing masks even in the house, and giving the potentially sick person dedicated space in the home to begin to self-isolate until they get their test results. And don't delay. According to the CDC, household transmission is common and occurs early after the onset of illness. Dr. James Merlino, Chief Clinical Transformation Officer at the Cleveland Clinic, told Health Essentials, "If you have to be in close proximity to the person who is sick, you can all wear masks, but trying to keep people separated as much as possible is the best thing you can do." In the early days of the COVID-19 pandemic, we wondered just how thorough we had to be with our cleaning protocols. We scrubbed our houses and our groceries. We left mail and packages outside and stripped off our clothes when returning home from our necessary errands. Spring 2020 was, at best, a confusing time. Since then, we've learned a lot about how COVID-19 spreads, mainly through droplets released when infected people cough, sneeze, or talk, according to the Cleveland Clinic. And while wearing masks helps reduce that person-to-person contact, there is evidence that the virus is present in droplets that land on surfaces, at least for a time, according to the New England Journal of Medicine. That means our household surfaces are vulnerable if someone in the family has contracted the virus and isn't in isolation. Researchers at the National Institute of Health found the virus can live up to 3 days on stainless steel and plastic surfaces. They recommend cleaning and disinfecting household surfaces regularly. Check out one of our newest videos right here. Plus, even more Health Digest videos about the latest health topics are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.